Start recording. Hello, everyone. This is Dr. Davila. I'm here with Dr. Aclan. Hope you're all doing well. Today, we're going to be presenting to you this particular parent training focus model. It's called Be on the Wall Supervision Model. The whole idea is to give you information of how you can be able to structure your parent training sessions and also be more observant, be more sensitive to each of the parents' needs and also client needs. And Dr. Aclan, not sure if you have like something else you would like to add to this particular topic.
This is something that we all probably practice already. This is just one to provide extra support, especially given that a lot of our parents are working with our clients directly, given the telehealth model. Please note that this is not a temporary thing. This is actually a model that we would like to adopt telehealth as well as in-home. So the information that we will be covering today will be some things that you could incorporate in your sessions.
Perfect. So let's move on to the first slide here.
All right, so the first slide, it covers the assessment phase. So with any behavior, we always want to assess the situation before we actually go into any treatment. So a big part of this is to get the family involved, as well as ensuring that we bring some form of momentum, buy-in, rapport with the family so that they are more willing to carry out any of our interventions. So we would like to first see when the caregivers are available in terms of when they see their child having the most difficulty. We would like to get the parents involved into what are situations that they prioritize as being things that they want to focus on, whether or not they're difficult or whether or not they're just things to go about their day. We want to ensure that it is important to the family. The important thing that we have to let the families know is that our job in this assessment is to literally sit or stay in a corner and just observe. We're not going to intervene unless someone's safety is in jeopardy. We actually just want to see what the entire situation looks like. What we will be doing when we're observing is obviously just watching what's happening, collecting ABC data. We might take frequency or duration data on how long certain interactions are occurring. And with that being said, we are not going into problem solving or developing any intervention at that point. We're just trying to gather data so that we could come in next time with some sort of plan. Let the caregivers know too that at the end of the observation period that you and the parent will have a discussion in terms of answering any questions or you asking the family of any questions.
Perfect. So I 100% agree with you, Dr. Acklin, about this particular process. A lot of times, when you step into a home and you immediately want to start providing recommendations and changes to routines, and it's very intimidating sometimes to parents. So for sure, I think that this assessment allows you to, take a step back and also evaluate specifically what those needs are for each of the families we work with. Like basically referring to some of this information about observing and tracking, this is what you guys definitely need to be looking at and taking lots of notes, asking questions. Preparing is also really important. Sometimes you have access to, a BIP or report that has been previously done for the client you're working with or consulting with. So it's always good to do some detective work, do some research before you even start going into your first consult. But for sure, when you're there, it's really, really important for you to observe and see how the parents interact with their child. Also track some behavior, which is the next slide. On some very specific type of behavior you can track is like how much positive interaction do you see between the client and the parent. how many positive comments is the caregiver providing to their child, how many prompts are they providing. You can write down the items and activities that you're observing that are being done during that particular time. And something else that was mentioned earlier, which is ABC data. So you can also track and record antecedent behavior consequence data to allow for you to be able to basically come up with a plan in the near future for this particular family that you're working with.
So a couple things to consider are, is this a skill deficit and we need to work on skill acquisition? Or is this behavior reduction, meaning are there behavior excesses and we need to focus on that? So two things that we have to think about is, at this point, the parent is our client, not the child. So with that said, we could think about, of course, it's behavior reduction because the client's engaging in tantrum or aggression. However, what we need to look at is if the parent is overly prompting, overly giving some form of reinforcement, we have to work specifically with a parent as to changing that behavior depending on what our intervention is going to be. So at this point, just like what we do with our clients, to think about, is this a skill deficit that we need to work on, or is this a behavior excess that we need to work on? We have to do that with the parent's behavior as well. So with that said, when we get more into detail with the skill acquisition consultation model, as well as the behavior reduction consultation model, there are specific pieces to look at. So a couple things that we need to look at in terms of skill acquisition is teaching preference assessments, prompting procedures. So are the parents giving the clients what they want, or are they just picking any item and then giving it to the client? As we know, as clinicians, we have to identify what the client's interests are. And sometimes if we assume, then our MOs are not in play and we are less likely to engage in the behaviors that we want to see. We also have to focus on prompting procedures, because if we're overly prompting or not prompting enough, we might see some errors in terms of the target behaviors. In terms of reinforcement delivery, are the parents not reinforcing enough, or are they reinforcing the inappropriate behaviors? Sometimes when parents say, well, I'm not giving them attention, I'm telling them to not do something, we as clinicians have to inform the families that still that is a form of attention and it might be reinforcing to the client. In terms of behavior reduction, we're looking at focusing on implementing the strategies of the BIP. So we look at proactive strategies, replacement strategies, reactive strategies. Even though we're looking at these separate, know that there might be times where we have to combine the two, because both of these specific areas coincide. So as you're working with a family, you might want to see what is either what is most important, what are the priorities. On another note, you might need to see what are the parents' preferences. Is it more reinforcing for them to give into certain things for their child so that they don't hear any problem behaviors or see any of the problem behaviors? Do you have to develop some sort of proactive strategies for the family or parents so that they are more likely to implement the BIP? So when we are working on this Be on the Wall, we are gathering information to answer these questions.
Perfect. And for sure, I appreciate you mentioned that, Dr. Aclan, the whole combination that sometimes you do have situations where we have skill acquisition, behavior reduction, things you need to look at. So I think that's something that's going to be very, very relevant to especially now with telehealth, and moving forward, when we go outside of telehealth, that we always look at those particular possibilities about whether it's skill acquisition, behavior reduction, or if it's both. So I'm glad that you mentioned that in there. So this is, a consultation, phase or model that, this is not something that you need to follow, like, specifically step by step, but it's a suggestion. It's an idea that you can be able to look at. And the way we did it is basically we looked at a 50-minute, session, what it would look like. So I put in here, or Dr. Aclan and I put in here, step one, where we would task analyze the strategy you want the parent to implement. So basically, when we talk about task analyzing, is you're looking at a very specific skill you're going to be teaching. Once you're done with your assessment phase, once you're done with gathering good amount of information, you should already have a sense of like what is it that you're going to be working with the parent, what is it that you're going to be teaching, and in order to successfully teach, you're going to have to like really break it down in steps. And that's why we put in here step one as a task analysis phase, where you're able to basically break down the skill so you can be able to teach it. Step two, review the written instructions before starting the session. So you can have a sit-down conversation and say, look, today we're going to be, reviewing the plan. We're going to be implementing these 5 steps. And for example, it can be like priming. You're going to be setting up a timer. You're going to be delivering an instruction. You're going to be providing reminders. So you're going to be able to provide a very, very, good breakdown before you even start running the next phase, which is a role play. For step three, we have practicing the strategy using role play. So you can tell the parent, look, before we even start implementing anything with your child, let's pretend that I'm the child. Let's pretend that you're going to implement this particular strategy with me, and I want you to follow the steps. And you can even refer back to the instructions so you can practice. And you can do a few trials with them. You can go back and forth, say, okay, look, you did it well. You started off really well. Maybe we can fix this particular step in the next one. So let's give it one more try. So you can be able to go back and forth with them. One thing that I always like to do is also model for them. So I'm the one that starts implementing. I say, look, just take a look real quick. I'm going to pretend to be, the parent, and you're going to pretend to be the child. So I'm going to show you how the priming procedure looks, and just pay very close attention to it. And then just follow. We're going to, take a turn afterwards. So you're going to be the parent and I'll be the child. So you can go back and forth in regards to modeling and role play. And essentially, you move on to the step four. Once you're done with those, steps, then you start going on to the phase where you're actually going to implement it with the child. And at this particular phase, you're going to just say, hey, if you have, if they have questions, if they do not, then you can deliver the SD to the parent and say, all right, get started. Let's implement this intervention. And then you're going to tell them you will be observing and providing them with prompts across the rest of the session. Now, it's really important for not, we talk about prompt dependency with our clients, and it also falls within the lines when you're working with parents as well. That if you do deliver too many prompts when you're teaching, the parent can also become prompt dependent with you. So it's really critical for you to not overly prompt, to slowly start, reducing those prompts. So fading those prompts as soon as you can. And then step five is tracking the implementation. I think that's so essential. You want to see whether the parent is truly, able to implement, right, and actually use the strategies with their child. And you're just basically telling how many prompts you're providing. So the less prompts that you're providing, the less you're needing to, give verbal or gesture, whatever kind of prompts you're using. That shows that the parent is heading the right direction. Okay, so it's all database. You still need to do a lot of data collection when you're doing this particular consultation. And then lastly, you finish the session with giving, some general feedback. I always like to give them, make the parent, feel like they're, heading the right direction. There might be some room for improvement, but you always want to end on a really good note and continue building rapport with the parent, so the parent won't feel like you're just there criticizing or overly judging their performance. So you want to say, hey, you did a phenomenal job. I appreciate the effort and the time. I see that you're definitely showing some great improvement. And if you have graphs or you have data, you can always show them that information and say, look, the next one we're going to work on this particular step. So always be very encouraging and provide that extra sense of support for the family. And then lastly, you schedule your next session, and that's where you basically end your consultation session there. So Dr. Acklin?
Yes. So when we talk about prompts and feedback, like what Dr. D had just mentioned, we don't want to overly prompt, just like we might be teaching our parents. Do not overly prompt. So And along with that, we also have to remember that we are always providing feedback. As behaviorists, I mean, we have so much research in both these areas, specifically in feedback. Immediate feedback is key. So, a couple things to know is be tactful. Remember, our parents are not are not behaviorists, so they don't really know a lot of our lingo. We don't really expect them to be as well versed as our BTs. So be tactful in what you say. You might want to focus on, the 4-to-1 rule, in the sense of 4 positives for 1 error, so that it does become motivating and it is more salient for the families to hear any feedback. You want to wait for the parent to make an error before delivering corrective feedback, in the sense of, instead of being so punitive, we also want to focus on reinforcement as well. Remember, feedback is both positive as well as corrective feedback. Reduce the amount of words. So again, focus at the behavior at hand, as opposed to embedding it in so much dialogue where it gets lost in conversation. And also, as I said earlier, our parents are not BTs, so we want to use as any layman's terms as possible. So instead of saying, present the SD, or, we need to contrive opportunities, talk to them as if you're just talking to someone about their behavior. They don't need to know about our technical definitions or anything like that.
That is so true, Dr. Aclan. That sometimes it's something, especially when I was starting in the field, I was so excited about using all these really cool terms, the terminology that we use in our field, and for sure, I can now look back that it was definitely something that required some feedback from parents. Actually, they would say, "What do you mean?" By this particular principle here. So I just think that in general, you're right. It's really critical for you to be understanding your audience, right, and kind of seeing how you can be able to truly get parents to follow the lead by being able to give them some really clear instructions. So the parsimonious rule is there, where you basically try to make it as simple as possible, so you don't have to get too you don't confuse parents with regards to what you're trying to tell them to do, or coaching them through that process. So going on to the next one, focusing on applied and less on conceptual. This is really important, because I think that when you think about parent training, there's sometimes that misconception that you need to go through basically this extensive curriculum of all these principles, like for instance, the 4 functions, schedules of reinforcement, etc. I mean, there's so many things that are out there in regards to things that we learn as clinicians, that we will love our parents to learn as well. But the thing with that is that sometimes when you kind of look at the overall scheme of what's going on with their lives, daily lives, it's very, very stressful. It's very difficult. And if you start adding more effort, more work to them, bringing extra ideas or extra things to the table, some parents might be really, really not liking the sessions too much, and they might actually push back in regards to getting consultations. So we highly suggest that instead of focusing so much on the conceptual side, it's good to also be a bit more attentive to what truly is the need for their child and for the parent. And sometimes they can be as a bathing routine. So like for instance, their child has a tantrum every time that they try to take them a bath. Sometimes we notice that maybe they're just not providing sufficient attention, and you start noticing a lot of attention seeking behavior. So that might be another thing to look at. So it's like it says here, too conceptual, there's a high risk of parents tuning out. So a parent literally not really they're there with you physically, but they're probably thinking of what the next task will be for them after you're out of the session. So in order to reduce the likelihood that that's going to happen, it's very important for you to find those particular behaviors, those particular target areas that are so important and so socially significant. We always talk about social significance in our field, but that really is the essence of parent training model, because that's really what you're going to be able to get more responsiveness and more attentiveness from the parent. Okay. So, Dr. Acklin, this is the point where we basically have our team, start engaging in some type of discussion. Questions or comments can be talked amongst, team members. Anything else that you would like to add to this particular discussion, Dr. Acklin?
I think we are set on that front. If any of you have any questions, at this time, CDs and CMs will have a discussion, and any further questions, the CDs will bring them up to Dr. D or myself, and we will get clarification to the team.
For sure. And then just as a quick update for the entire team, we are working right now internally in creating some modules for parent training. I've already completed the Spanish speaking parent training module, so I should have those completed. And we're also going to be recording English as well. So we're going to have more resources for parent training consultation. But I think that this particular discussion to the presentation we just gave you, I think it's going to be very, very helpful for you. I for sure, I look back at my experience, in regards to providing parent consultation. And for sure, I can tell you that the best, experience I had was that, being a better listener, being a bit more attentive to the parents, hearing them out. A lot of times we want to come in there and try to impose, all of this knowledge we have. And we have great knowledge, but it's also important to be very, very sensitive to other things that are going on with family lives. It's also very important for parents not to, kind of get used to this, consultation model where you're just sitting down and talking. Because we're not a counseling service, whatsoever. It's very important that we basically have that sense of agenda, sense of structure, and that we're there to help them, help them and also help their child out with that particular process. So thank you so much, team, for the effort, and thank you, Dr. Acklin, for assisting in this presentation. And if you have further questions, go ahead and reach out. We're always available for you guys. All right, guys. Thank you so much.
Thank you.